So,
yes, sir.
and the majority of the students have finished their postings, clinical
Yes,
as well as theory, and have finished a few of the internals also. Almost all of them have finished the final internals also. They have left with less than a month. If you take with Rajiv Gandhi University or any other university deemed university exams, so 1 month is there for theory and another 10-15 days for their practicals. So, and after going, and the curriculum for this particular batch is little bit different as far as the theory is.
Yes, so that's the apprehension, sir. This is the first time that CBME batch is going to take up examination. So they are a bit apprehensive. What would be the pattern and how the questions will be coming and all those things. So how the I don't think, sir, there should be any apprehension regarding the pattern and all. Already you have made sure how the questions will be, everything. But my question to you, sir, how they should be just 15 or 20 days before the exam. ENT is a bit volatile subject. Okay, how much we read beforehand, last minute revisions is very much essential. So what should be the strategy while revising the ENT subjects?
Okay. Coming to the entire syllabus of ENT, the biggest problem that what the students face compared to other major surgical specialties is the amount of time they spend in the clinical postings is significantly less, 1 month, or another 15 days in their second year, which the students will not be that keen when they come in the second year. But when they come here for the final year, and they will be there with us for 1 month, and majority of the times before they start understanding, their posting will be over.
Okay.
And in terms of theory classes, which they are going to see, hear, or learn from the books as well as from the different lectures which they are going to hear, the challenge that they face is that everything appears similar.
Okay.
Matlab, what I try to say is that they feel that it is bit overlapping between the symptomatology and the science. By going through their recent examination in our own institute, so we have found out that the students read. I'm not saying that they don't read, but they don't put their proper understanding of the subject as together. If I can show a few of the examples now in due course of time during our discussion, I will show how exactly they will write and what as a teacher in the thing expect them to write is that they have to give more importance for the common symptomatology and signs which they elicit. Invariably, if I take before going to that, the strategy which they are going to do in the next 15-20 days is that already they have read quite a bit. So they have to make their own small groups, say about 2-3 groups of their own small groups. And they have to start discussing about the major questions, which are about 15 marks each. And the small questions, say about 8 marks and 2 marks questions, where they are going to, one person is going to ask the question and another person is going to tell the answer. And if there are anything which the other student who has already read is also going to contribute, so that they hear from the other 2-3 students, which there is a small group, so that they can remember that things in the better way in the examination. So since every time we used to tell that go through the previous question papers and refer the previous questions, go to the previous questions, the last 10-year questions you solve. But for this particular batch, the problem is that they do not have the previous batch CBME things. They are the first batch students. But that doesn't mean that the questions which they are going to face is going to change. The subject is once again the ENT. The questions are also going to be the same thing, but definitely there will be little modification in the pattern of the questions which we are going to face. In the sense, sometimes the main question will be given as a clinical scenario, and they are going to ask that what is the diagnosis. If they write the diagnosis, then they are going to write what are the investigations and what are the treatments. If by reading that particular short essay, if they fail to understand what is the diagnosis, then the subsequent answers which they are going to write will not be distinguished. So this is the biggest challenge. Otherwise, every time that will be the defined cholesteatoma, clinical features, management. Fibroma, clinical features, management. So this used to be the pattern earlier. Now they say that an 18-year-old boy comes with a history of unilateral profuse epistaxis, so with a nasal obstruction. So this is the clinical scenario they are going to see. And if the patient has understood that, okay, this unilateral epistaxis in a male boy will be an angiofibroma, and they will be writing that this thing. So it will not be a lengthy answer. It will be a very
to the point. Yeah.
To the point answer.
Yes.
So that the evaluator also will go through that. And the moment when they write, then this thing, so it is easy for them to score more marks rather than the earlier batch students. But definitely it is going to help for the people who have read very well. Moderate for the people, because it is a better pattern than compared to the previous one.
So now, sir, which are the important topics when they're revising? How they should be revising, concentrating on which topics they should give more stress to? In theory.
In theory, yes. Since it will not be as vast as your surgery or the medicine or the pediatrics, there is a small book of about 400 pages.
Okay.
The majority of the students, whether across India, they will read either our Dhingra or Bansal, or for that matter, our Manipur book written by Dr. Deepak Ranjan Naik and this thing. So these are the three standard books which they are going to read, about 500 pages. So there is nothing which is more important or less important, because even if they do well in the main questions and if they forget to write the properly about the short answers,
they will lose.
Be in a position to score a good marks. Like to say is that touch up everything. Okay. Sometimes they maybe have an anatomy questions also. Write this diagram of a Walder's ring, or write the components of a Walder rings. Okay. Write about the cartilages of the larynx. So because we are going to teach them the anatomy of the ENT also. So there may be a 2-mark question which may be asking about the cartilages of the larynx, which they have to know about this thing. But definitely main questions, they have to prepare it well. So basically when it comes to pathology, definitely it is the CSOM, then secretory otitis media, otosclerosis, then Meniere's disease and acoustic neuroma. But if that comes to a nasal cavity, definitely it is the nasopharyngeal angiofibroma, chronic sinusitis, then the carcinoma of the paranasal sinuses. When it comes to the larynx and the throat, this thing, so vocal cord palsy, then stridor, then malignancy of the
larynx,
malignancy of the larynx or hypopharynx. So these are the standard main questions, and short notes can be anything.
Yeah.
So they have to give importance to every topic and more of a discussion, and they have to keep on thinking. In the next every day around 16 to 17 hours, they have to only think about the question answers, so that it will definitely get impregnated rather than reading. If they forget to read, if they forget to recollect, then immediately go and see this thing. Open that particular chapter and see that what they.
Yes. Yes.
The other thing which I want to stress here, that the students will not write the detailed signs and symptoms. They write hearing loss, whether the conductive hearing loss or a sensory neural hearing loss, progressive hearing loss or a static hearing loss. They will not mention about this thing. I'll show you the thing if you allow me to share a few of my screens. been asked about the definition of a cholesteatoma, the clinical feature, the signs and symptoms, and the management. And if you go through this particular question, he has written that, okay, this is skin in the wrong place. He has written a diagram well. And if you come here, here in the etiology, he has written, okay, how to go to the next page? How to go to the next page?
You have to close, sir. Close this and next open the next one. Close that. Cross mark, sir.
Okay,
yes, sir.
Okay.
Yes, sir. Yes.
Okay, so write it here the same. Clinical features, he has written it discharge. What type of discharge and hearing loss? He has not mentioned anything about the hearing loss. It is a conductive progressive hearing loss. And he has written about the examination tests here. And now when it comes to the signs, he has written about the audiometry and speech audio
yes, sir.
discrimination score. So he knows the subject. I'm not saying that he has read, knows what is speech audiometry, he knows what are the things, but the way he has written is completely not this in it. I don't say that he is going to definitely not going to get more than 50% of the marks. And if you come to the management, look at here, the CT scan and X-ray, this is a major mistakes majority of the students do. They write all the radiological investigation. X-ray, CT scan, MRI, angiography. The examiner let him take whatever he wants. This doesn't. So they have to be more specific in writing their investigations. Now coming to this thing, I'll show that. Look at here. So culture and sensitivity, biopsy. This is completely wrong. This thing is. And if you look at the entire management, treatment, you look at the surgery. He has written myringotomy, tympanoplasty, mastodectomy plus stepidotomy, then ossiculoplasty. So this is completely that particular students definitely feel that I have written everything.
Yeah.
He feels that okay, I have written everything, but unfortunately, the whatever he has written is partly correct. So our intention as an examiner is not to fail any candidates unnecessarily, but at the same time, we will now he can't ask us to pick up the things which I want.
Yes.
He has to write it as it is required. Now I'll show you another example that how the good students write is. Look at this, the flow chart which they have written it about the etiopathogenesis. The moment I see the paper, it gives us an impression.
Good impression. You'll not go to read what's there inside, sir.
So how much time I take to read a page is say about 1 to 2 minutes. Because in 1 to 2 minutes, I will see that entire sequence of the things which he has written. Every other students, out of the 200 students which are there in the class, all the 200 students read. It is not that they don't read, but the way they put their views in the paper differs. So what I want to say to all the students who are going to face the exams in the near future is that try to practice your answers in a proper way, in an order and in a methodical way. Never ever write ambiguously anything that thing, and it is not that filling a page will give you marks. That is the what do you call that unwanted concept which is filled in the student's mind, that you just fill the page and the examiner will give the marks. No, this doesn't. There are no examiners which doesn't just give the marks like that. So they'll definitely read. It's not that we don't read. We go through the each and every question more meticulously, and for the short question they did not have to write a pages together. To see the marks which has been allotted that, and they have to divide in that and try to write it the answers. These are the few of the examples which I just wanted to share with the students. Though these are the university, and look at this particular boy. Isn't it? Very shabbily the answers were hidden. So it's and I don't think I'm not concentrating on his handwriting, but I have to literally pick up his what exactly this particular boy has written. So I will read this particular answer and then allot him the whatever the marks this particular paper desires. So these are a few of the examples which I just wanted to share to these young students who are going to face the examination. And this is the question paper. Okay, this is the recent question paper which I was just trying to tell you that okay, this is how we are setting the questions now. Like this is 14-year-old present with left nasal obstruction and recurrent episodes of spontaneous profuse. The answer will not be trying to confuse the students. We are very
straightforward.
Straightforward that there will not be an ambiguity like what we ask in postgraduates, because we understand their difficulties. This thing. We wear their shoes. We wear literally their shoes because we were also once upon a time the students like them. So definitely we understand them and try to put the questions in a very straightforward way so that they can understand and write in an examination. So these are the different questions. Now these are the two case-based scenario questions. These are the 15 marks, and now this is it. So it will, if they write the most likely diagnosis, then they will get the full marks. So they can get more marks. They definitely scope to get them more marks rather than the previous that for 5 they will be always giving 2.5, 3, not like that. So this paper is much better as compared to the previous ones. Okay, Kishan, is it okay?
What about? Yeah, fine, perfect, sir. You are making it very clear, as well as you are encouraging them also, sir, telling only the positive aspect side. And the second thing, what about the practical, sir? Only I think 3 or 4 important cases will be kept for practical examination. How do they prepare well in advance? Most of the students, what the mistake they do is just after the theory, they freshly open up prepare for practicals, and in a hurry they'll understand only superficially and they attempt the practical examination. Is that the right way, or they should prepare well in advance for practical as well?
Kishan, and at this juncture, I don't make them to read too much for the practicals, even if they go through the half an hour or 1 hour for that thing, because majority in ENT it will not be like your general surgery or the general medicine where they will be keeping neurological case, cardiovascular case, respiratory case. We will not be keeping them anything in the larynx or in the, so they will have either tonsillitis or adenoiditis, a deep nasal septum, polyp, atrophic rhinitis, and granular ASOM, CSOM, and the okay, that's all. The 7-8 cases, if they have written well their case sheet or their journal properly, what we encourage the students is to complete. The majority of the students don't write the treatment part in their journals.
Okay.
The biggest problem with the students is they are not the part of the treating team.
Okay.
They are just an observers. If we can take them as a part of the treating team and ask them to fill that this thing, whenever we are verifying their case sheet or their journals. So now for tonsillitis, what exactly we do? What investigations we do? What is it? All the medical colleges are doing the standardized treatment protocol which has been accepted universally. The investigations, whether you do it in Bangalore, whether you do it in Bangalore or in Hubli, universal. For CSOM, they are the your blood investigations, pure tone audiometry, X-ray mastoids, photomicroscopy. This only, not much. People, if they write MRI, it will not be a right thing on their part. So the investigations are also standardized. They have to write the investigations and the treatment. What the mistakes they do is in the examination also, though they have a time, they will not write the investigations. They stop at the diagnosis only. And they have to write the complete diagnosis in the practical. They write only CSOM. What type of CSOM? It is mucosal or squamosal, whether it is active or inactive, whether the patient has got any hearing loss, what type of hearing loss, conductive hearing loss.
Complications, yeah.
It's the diagnosis, complete diagnosis.
Complete diagnosis.
You are unnecessarily giving a chance for the examiner to ask again and again, same things. So, and invariably the time they are going to spend with each case, with each examiner is about 7 to 10 minutes. So if they can able to answer more questions during that 7 minutes of the time or 10 minutes of the time, because we have got a limited 25 candidates in a day. So we have to finish 2 cases and instrument and Viva OC. So if they answer more number of questions, they get more marks. So they have to unnecessary, they should not waste time in this thing. So they have to present invariably. Sometimes they ask that in the beginning for students, they ask that, okay, present your case. And in the second time, they say, okay, tell your diagnosis, then what are the positive findings? They should understand what the examiner wants. If they ask that, tell me only positive findings, they have to tell only the positive, relevant positive findings, not just, okay, pinna is normal, preauricular area is normal. This thing. So they have to directly go to the external auditory canal. There is a discharge, there is a tympanic membrane perforation, central perforations, tuning fork test shows about conductive hearing loss. Finish. Nose and normal. Finish. So this is how they have to prepare for their practical examinations. Instruments invariably during their postings they have seen, and if they can able to name the full name of an instrument like Boyle Davis mouth guy. So because it is a credit which we are going to give to the person who has invented.
Yes, sir.
So that we have to practice it so that it gives a better impression in the examination. I think that is how they have to prepare for their practical examination.
Viva, sir, how do they do usually in Viva, sir?
Viva will be invariably along with the case only. They will be asking about Viva OC, and they will be a majority of the examiners ask that what are the cases you have seen in your clinical thing. And they can drag the examiner to the things which they have known. So they may ask that, okay, which subject you are good at this thing. So if you
Okay.
okay,
Which surgery you know, which
instrument you know, or which you
instrument,
instrument or whatever.
Pick up any instrument,
Pick up any. Invariably, they may ask that, okay, pick up the tonsil instrument. So they have to arrange that tonsil instrument. So pick up the instruments for the tracheostomy. Invariably, every student will be asked about tracheostomy because that is the most life-saving procedure. So they know about the different tubes of tracheostomy, metallic, non-metallic, then about the cuff tube, uncuffed tube, what is the use of the cuff, where they use the cuffed endotracheal tube. So how frequently they change the endotracheal tube, how to monitor the cuff pressure. So all these things are going to be more important because as tracheostomy, every medical graduate should know about the procedure as well as care of tracheostomy and the different tracheostomy tubes. They may not be interested to know about how you are going to manage the malignancy of the larynx or how you are going to manage the esophageal stricture or that kind of a thing, but definitely they are going to ask about the tracheostomy. Basically, we are interested that as an undergraduate, how much they can able to understand the ENT as a subject and manage the clinical scenarios. Like if the child suddenly comes in the night crying, that what you are going to think. So with a nasal discharge and rubbing of the ear, so ASOM. If they can able to tell these small things, definitely they can score very well in the practical examination also.
Sir, some face Shifa is asking, sir, in a short essays, for example, if they ask you, see in that example model question paper, you whatever shown, they are asking particularly write a note on graft material for tympanoplasty. That's agreeable, sir. Instead, if they ask just tympanoplasty for 5 marks, then how do we go about, sir?
That
because
is what
tympanoplast you can write pages together.
Pages together. That is what I am saying then.
So how to put what really examiner expect to write in such a situation?
Okay, so if it is for a 5-mark question, the way I want them to write the definition of a tympanoplasty,
Okay.
types of the tympanoplasty, graft materials used for a tympanoplasty. If they can write few of the complications, that is well and good. So they need not have to write each sentence there.
Okay. Point wise.
Bullet this thing. So that will be more appreciable rather than writing entire sentences. So 5 marks question, if they can write this much, the thing commonly use. If they write only temporalis fascia also, they are going to get the complete marks. If they write the other graft materials, that will be more this thing. So these questions which the answer will give this thing. Suppose in the end that particular candidate is having a short of time, and if they cannot able to write, so I will be definitely considering his overall paper performance and considering it. So that will definitely, that is why we encourage them to write the best known to them to write, so that in the end as they go, so but they should not unnecessarily waste their time in that. So their time adjustment is also most important.
Yes.
They just skip 2 or 3 questions, then they may not do well in the exam. Okay.
So already some people are asking what is specific insight for revision and remembering anatomy. Sir, how to better, how can we remember better, especially in ENT, any surgical field for that matter, anatomy is very, very important. So pertaining to ENT, sir, how can we remember better? And any from your experience?
So this is really a challenging thing for them, because the most complex anatomy in the entire human body is ear. So the middle ear and the inner ear. So and we will not be much asking about the only thing in the inner ear what we may ask for them is about the organ of quality, if they are asked about that. And will not be asking for these people the inner ear anatomy, and that is a postgraduate question. We may ask about the middle ear anatomy. If they write about that it has got a 6 walls, then the contents like ossicles, air, and the muscles. So that will be the thing. So the diagram need not be a very artistic diagram. It should only depict that, okay, this particular candidate knows the thing. So immediately they can go to YouTube and watch the anatomy related videos. There are a lot of anatomy related videos are there that definitely will help them for the examination for their entire design. So I insist them that not to just concentrate on this particular examination, though it's too what I get that short this thing is, but definitely they have, these people have got an MCQ also. 10 marks MCQ for these people. So whatever you people read for a postgraduate ENT, if these people read about all the MCQs, and that is a 10 out of 10. So there will not be any difficulty for them to score 10 out of 10 in the MCQ part.
Sir, one more thing. When I'm writing, if I randomly write, like you said, whichever you know better, you write first. If I keep on randomly write first one first, and the third one second, and then the 10th one, if I randomly write, how it feels for examiner to really search for. Nowadays in Rajiv Gandhi and all, we have a like what say predetermined number of pages, and the questions already written.
Also,
but if it's some university, it may not be the case. In our old style, like whichever comes to whichever we know, we'll keep on writing. Okay. So if we keep altering the order or the questions like this, will it not be difficult for the examiner to really find out where is which one and to correct? That will make troublesome for the examiner, and he'll get irritated, and the marks will be inversely proportional, I feel.
It happens, Kishan, but we do search. their number. Sometimes the students will not be writing the exam, and then question number only. Because they're stressed out. No, we have invariably
the common mistakes then, irrespective of telling multiple times before the exams and during the exams. Even then, some students tend to miss out all these and make this.
But as far as possible, that is the why that we have conducting their internal examination and
to practice.
To practice. So
Yes.
even if they can practice in the room also, as because these are going to be a very important this thing.
Correct, sir.
Okay, they can make a mistakes and escape it, and the legibility of writing the number is also going to be more important. So that, and a lot of the people write one answer and they'll make a this thing. This is not right. They'll just write
The big,
scribble it and this thing. So these are the things which happen, but unnecessary the time will go waste. So just read the question paper first, just 2-3 minutes, go through that. And if it's a difficult question paper, is difficult for the entire batch. They do not have to panic about that. Okay, this is a difficult question. It is going to be difficult for everybody. So examiners will be definitely considerate in
evaluating such questions.
Evaluating the paper. So there is no easy paper or a difficult paper. It is a moderate invariably. We are only interested to assess their knowledge, and we should definitely be interested to discriminate every student from the other one. Otherwise, it will be just giving a uniform marks to each and every student. It doesn't happen. So those who are read well, those who have prepared well, definitely are going to get more marks. Those people who are just trying to this thing, which I showed this thing, they are not going to. These students definitely think that I have written everything, but I have got a less marks.
Yes, sir.
This is the common complaint we hear from the students, that I have written everything. So this is how they have written it. So unfortunately, we are not supposed to mark anything in the question, their answer book. So we have to just write it. Earlier, we used to mark that entire thing in the round with a red ink pen. But now it is all digital.
Nowadays, you have scanned copies now in computer.
Yeah, we have in Rajiv Gandhi University, we have got a scanned copies.
Yeah.
So
earlier you have that freedom of writing.
Writing everything. So
sir, one good question from Mr. Najib Khan is asking that earlier, sir, in the previous pattern, this Meniere's disease and inner ear, all this to be the important topics and topics of questions. But nowadays in the CBM, as per CBM curriculum, these are the non-core topics. These are considered to be just like you mentioned, these are not important for the UGs. These are considered to be non-core. So how this is what makes the students a bit apprehensive, because although as per the curriculum it's not important for the clinical practice, or maybe who knows, old examiner without seeing the proper curriculum, he may not just give the same question. So this is what makes student bit difficult.
Correct. What this thing is. So I just want to tell all the students here that the curriculum has been changed, but the teachers are the same. So we are the same teachers for the previous batch students and the same teachers for the present batch students also. So there is the guidelines which have been set by the NMC are a little tricky, but that definitely if and questions which we are going to set, whoever is going to prepare their question paper is also according to the pattern which has been given to us.
Okay.
I don't have a whims and fancy of choosing what I want.
Okay.
So they should have to be very sure about that the pattern which they have studied, followed is going to be the thing which
understood.
Yeah.
That's it, sir. Any concluding remarks from your side, sir? What you really finally, what's your best wishes for your students? You are very, I know, sir, I know you personally. You are very student friendly and very much approachable for the students, and you have been like decades of experience now being a
My
teacher?
only thing is that the medicine should not be learned with fear.
Okay.
So people should not learn medicine with fear.
Okay.
They have to, and they are the students. They
Okay.
are completely raw. They don't know anything, and they have come here to learn. See, we have put quite good number of years as in this profession. Definitely, we can't just say that okay, you don't know anything. You don't know anything. They have to learn. So my entire thing is that learn without fear.
Okay.
Not only ENT, anywhere when they go to a medicine surgery and this thing, spend more time in the clinics. Because now whether it is your next examination or the final year examination or the next examination is going to be more of a clinical oriented, and so they have to spend more time in their clinical scenario, clinical posting, so that they can learn and actively participate in whatever the smallest doubt is there. Unfortunately, students don't approach, sir, I have not understood this. It's not that okay, we will sometimes we will not be in a position to deliver according to their things. So if they have not understood, they have to approach us in whatever the way they can it, so that we can able to clarify their doubts and all. The only thing which I want to tell is that all the best to all the exam going students. Do well. I know that you all have chosen. This is only the profession which the students choose their profession.
Okay.
The rest of all the people will be by default, they will be choosing their profession, but the medicine is the one which they invariably the students chooses to become a doctor. So definitely read well, and in this next 23 years or 1 month, keep your health in a good condition.
Okay.
Necessary take undue stress, and don't compare. Okay, he is reading more or she is reading more. I am not reading. So you are your own individual, and everybody has got a different ways of reading and remembering. So it is only I may given a little bit of suggestions, but it's not that you have to follow exactly how you what I have put. So you have got every way of reading and writing, and keep your health in a good condition. In the last time in the examination, if you fall sick, then your entire effort of you which you have put it for 1 year will go in waste. So keep this thing. Don't unnecessarily eat outside. Avoid this thing. As an ENT surgeon, definitely I will tell that in this cold season, avoid cold drinks and ice creams as your eatables. And take care. So read well and do well. This thing from my side.
Yes.
I wish all the students who are the White Man Army, and Kishan, I definitely appreciate you for taking an initiation to through us this thing. So conveying this thing, because usually we will be teaching to our own students, but this platform has given us to talk to other students across the state and across the country. So thank you very much for.
No, the students will get benefited, sir. They get to learn from the best teachers, irrespective of which college. See, everyone's dream in Karnataka to go into like KIMS Hubli maybe, or BMC, or maybe MMC. But everyone is not that fortunate. Only 500 students may get into these. But here the advantage is that irrespective of the college or state or the country where they're in, they get to learn from the best teachers possible in every subject. So even the students are very much privileged, and they're happy, sir. They do.
You are giving them a platform to interact with this thing.
It's my duty, sir, being a senior. Whatever I didn't have, I should make them available. Okay, sir. One more good question. Mr. Neeraj is asking, in a case-based questions, what should be the format for writing the provisional diagnosis? Like, should we describe in detail? Good question, Neeraj. I would like to answer that. See. Like whatever the sir has shown in the picture, he has given the case scenario, and he has asked what is the most likely diagnosis, and look at the mark distribution there. There is only one mark for that. What is the most likely diagnosis? So look into the mark distribution and accordingly write the answer. Okay, for 1 mark, if you just write, see, for the first question, it is, what is that, sir? Nasopharyngeal carcinoma, right?
Angiofibroma.
Angiofibroma. If you write, it's a 1 mark you will get. You need not keep on describing about that. So every time look into the mark distribution. How much? See, it's specifically mentioned for each question there is 1, 3, 2, 4 marks. So correct, no sir? What I told?
Yeah, exactly. What you are saying is 100% right.
So always look into the mark distribution and accordingly you write the answer. Okay, and in this CBME pattern especially, they have made it very clear. Every question is subdivided into 3-4 sections and where to stress which one. See, in this modalities of treatment, this carries the maximum marks, 4 marks. So we have to be stressing more on the treatment aspect rather than the laboratory investigations and all, which carries only 2 marks. So accordingly you write. Definitely examiners are they're eagerly waiting to give you more and more marks. Okay, they're the not one who are want to fail you or something like that. They also will be finding where to give marks. So if you written something, means attempt all the questions. That's what all the examiners say, teachers say. Attempt all the questions. Don't leave any questions unattempted, because that will give them a chance to give you at least half a mark, 1 mark or 2 mark minimum, whatever possible. Okay, so that's it. Good questions. If you have any more doubts, please put them in the YouTube chat sections. I will forward it to sir and get it answered by the our Gadag sir. So sir, it's late I think for you for your dinner, and you just come back.
Sorry, I was held up in the other day, so I could not able to take up on.
Sir, can they use color pens and all in the examination, or they?
Yeah, definitely they can use. Definitely they can use the color pencils to draw a diagram. More impressive also. And it will be, they need not have to spend too much of time during for drawing a diagram. They have
the schematic diagram. Most important, more than the diagram, label diagram.
Labeling has to be done. This thing. Don't necessarily write investigations. That is what I personally advise to the students. Specific investigations are there for each and every disease.
Correct.
You can pick up those things and write it. So in next time when we finish off this thing, if we are discussing about the clinicals, I'll have something to tell this thing, because there will be overlapping of the symptoms, how they have to understand that. In some other time we will definitely discuss.
Sure, sir. All like students, almost all the videos on ENT cases and many important topics are already available in our channel by Ravindra Gadag sir. Yes, extensively dealt with most of the important topics. So please, whenever you are free or at your convenient times, go through them, revise them, so that each topic is covered entirely. Once go through the book first. There is no substitute for books. First read the books, and for a better understanding, or from to look into the examiner's perspective, how they ask questions, how we should answer, how not to answer, everything you learn by those videos or case discussions. Thank you so much, sir, for your valuable time and valuable insights and inputs. The students will definitely, they're going to benefit by your words of wisdom and experience. You're always with us and need your blessings throughout, sir.
Yeah, thank you, Kishan.
Thank you so much, sir.
Okay, all the best. Bye.